Hello everyone, welcome to part 2 of our first chapter. In the last few slides of the chapter, we're going to talk a little bit about the anatomical and some of the most common directional terms that we will use in A&P. So let's start with the position. So the standard position in A&P is when you have your subject or your patient standing up straight in an erect position. Feet are pointing forward, slightly apart. The palms are outward facing with the hands on the side of the body, and the thumbs are pointing in a lateral or sideway away from the center point of the body. And as your subject is standing there, what we see is that we can then use certain directional terms to coordinate a particular location. Like, for instance, if you're trying to describe a location of a bone, a muscle, or an injury. And when you do that, you often will utilize, the terminology of the left and the right. Now, please keep in mind that the left and the right will refer to the body that is being viewed. So your subject's left, your subject's right, not yours. For example, go look over here at table 1.1. If we start off with the figurine, we could see that it is in the standard anatomical position with the body standing up straight forward, face is pointing forward, the legs are slightly apart, the feet are pointing towards the front, the hands are towards the side of the body, and that the hands are located with the palms facing upwards, and like I said, the thumbs facing lateral or to the side of the body. Once you have the anatomical position, you can then use some of the terminology to describe things that are above, below, towards the front, towards the back. And we can use terminology such as superior and inferior to describe anything that is above or below a reference point. So for instance, here in our definition, it says superior is going to indicate towards the head end or upper part of the body. So if we come over here to our subject, we can, for instance, pick anything that is towards the higher end, and nothing is higher than the head. So we can use our head as an example, and we could say that the head is superior to the thoracic area. It is superior towards the abdominal cavity. It is superior towards the knees. It is superior towards the feet and the legs, because superior means that it is above. So superior means above any structure or reference point, and in general, it means towards the head end, the top part of the body. Now, opposite of superior will be inferior. Inferior means below. Now, the lowest point of the human body will be for our feet. Once again, based on the anatomical position. So we can say that the feet are inferior to the knees, to the pelvic region, to the abdomen, to the shoulder, to the head. Once again, indicating that the terminology of inferior means below. So superior towards the top, inferior towards the bottom. And you can utilize it different ways. So for instance, you can say we're doing a comparison of different bones, right? The bone that's found in the upper arm is called the humerus. The bone that's found in the upper thigh is called the femur. So you could say that the humerus is superior to the femur because it's above it. And then, of course, we can reverse the direction and we could say that the femur is inferior to the humerus because it's below the humerus. So up versus down, superior versus inferior. Now, what if we want to do front and back? Well, then we're going to use anterior and posterior. Anterior means that it's going to be in front of, towards, or at the front of the body, whereas posterior means it is behind an item. Now, let's take a look at the example that the book is using, right? So it says the breastbone is anterior to the spine. Now, the breastbone is that bone that you feel right here on the top part of your chest. And of course, the spine is located towards the back. So it would make sense to say that the breastbone is in the front. So instead of saying it's in front, we would say the breastbone is anterior to the spine. Okay? You can even say something as simple as the forehead is anterior to the back of your head. Or you could say your stomach is anterior to your buttocks. That's another example. Your knees are anterior to your calves, so meaning that they are in front. Posterior is that they're coming from behind. So now we're doing an example such as, let's see what this one says. It says the heart is posterior to the breastbone. And that's correct because behind that breastbone sits your heart beating away. We can say that the butt is posterior to your thigh, or our little example we just had with the kneecap. So we could say the butt is posterior to the knees, right? Your back is posterior to your stomach. These are all examples that will indicate the back of it. Now, some of you might notice that next to anterior and next to posterior in parentheses, we have some other options. So we see that we have anterior and ventral, and we have posterior and dorsal. When we are referring to the human body, or really basically any type of organism that is standing upwards on two legs that has a clear front and a back, you can interchangeably use these terms. So it doesn't matter if you use anterior or ventral when it comes to the human body, both of them will indicate towards the front. And with posterior, you can use posterior or dorsal. Once again, both of them will indicate behind. The difference between the terminology will appear when you have a four-legged animal or organism that you're looking at. So this is my attempt of drawing a dog. I know it's horrible, but just bear with me. So this is our cute little dog. Here's its head. And there's the tail. Now, when you have a four-legged specimen, what we see happening is that the face part, we're going to refer to that as anterior. So anterior will be towards the face, towards the head, and then towards the tail, we're going to call that posterior. So anterior in the front, posterior in the back. So far, so good. And now what we're going to do is we're going to use the term ventral and dorsal to describe what's happening around the abdomen section. Ventral is going to indicate the belly side, and dorsal is going to indicate what's happening on the back of the organism. And in fact, if you don't mind, you can take a look right over here. It kind of describes the fact that when you're doing a four-legged organism, you see that ventral is specifically referring to the belly, and that we're going to be utilizing our dorsal to indicate what's happening on the back of the animal. So that's the only difference really where you would have a difference between anterior and ventral and posterior and dorsal is when you're looking at a four-legged animal. So in humans, once again, anterior is the same as ventral, posterior is the same as dorsal, towards the front, towards the back. But in a four-legged animal like your dog, your cat, anterior would only indicate the face, posterior the tail and the butt, and then the belly side would be ventral, and the dorsal would refer to the animal's back. Okay, so we have up and down, front and back. Now let's talk about middle and side. If something is towards the midline of the body, so imagine drawing a line right down the middle of your body like they have right here in our little figurine. You have our reference line. If something is closer to that midline, we would say it's medial. So it's towards the midline or it's on the inner side. So the heart is a really good example because the heart sits right towards the middle of the thoracic cage. So we could say the heart is medial to the arm. So it sits in the middle. Now, lateral is going to indicate that you're going away from the midline, follow the arrows, or you're going towards the outer side of the body. So if we were to go back to our first example, it says right here, it says the heart is in the middle or medial to the arms, which would then mean that the arms are lateral to the heart. Or in this case, they said the arms are lateral to the chest. So medial means towards the midline, lateral means away from the body. And this will often be used to describe the appendicular, the appendages, so like the arms and the legs, pointing away towards the side of the body. And then if you have something that is sort of like in between the middle and the side, then we will utilize intermediate. And I really like the example that the book uses. It says the collarbone is in between the breastbone and the shoulder. That's a really good example because as you palpate the collarbone on you, you notice that you can go towards the midline, which is where you would encounter the breastbone, but you can also go laterally where you would encounter the shoulder and the arms. So medial towards the middle, lateral towards the side, and intermediate is that happy median, a little bit towards the middle, a little bit towards the side. Lastly, we can utilize proximal and distal. Now, this is usually used to indicate a origin point and the distance from a secondary point. So you can utilize the example where it says it's closer to the origin of the body or the point of attachment of a limb to the body trunk. So it says right here, it says the elbow is proximal to the wrist. That's very true. So anything that is near your original point of reference or an attachment point, we'll use the term proximal. So we could say that the knees are proximal to the ankle. We can say that the shoulder is proximal to the head. And then as we get a further distance, then we're going to use the term distal. So now we have a further ending point from our origin point. So this one says, for instance, we can say the knee is distal to the thigh. You can also say that the knee is distal to the elbow. The feet are distal to the shoulders. And once again, this just indicates that there is a further stretch point between your origin or attachment and your secondary point of comparison. Our last two terms for this table are going to be superficial and deep. I don't know where the superior came from. Superficial means that it's lying directly on the surface, and deep means that there's usually a layer that is hidden above it that needs to be removed before whatever item you're looking at can be observed. So for instance, your skin is the most superficial aspect of your body, okay? Because that's what covers it. If we were to remove the skin, then we would start seeing things like our muscles, our bones. Those are all deep. If, for instance, another example I'd like to give you is you have a muscle called the buccinator muscle. That's the muscle that we use for making things like, the duck face that some people like to make when they do a little selfie, when they just suck in their cheeks. Well, when you do that, that's the buccinator muscle. In order to get to the buccinator muscle, you have to first go past the zygomaticus and the rhizorius muscle. So that's an example of a deep muscle. But like I said, superficial means on the surface, the first layer, and then deep usually means that there are additional layers that have to be removed before you get to your point of comparison or the point that you're trying to examine. Within the body, especially when we take a look at things like our bones, there are two major divisions. You have what we call the axial, which form the standards, the mid part of the body, so our head, our neck, and the trunk. And then we have the appendicular division, which are going to be the limbs, so your legs and your arms. We can also utilize different scenarios or different cuts and planes to study the different angles of cells, organs, organ systems, and the body. And here in this particular section, we see that the three most common planes, so once again, these are ways that we're going to be cutting the surfaces or the items to study, are going to be to make a sagittal cut, a frontal or coronal cut, and last but not least, we can do a transverse or horizontal plane. So what exactly does that mean? Well, when you make a sagittal cut, what you're doing is that you're cutting so that the body is divided into right and left. And you can do this directly from a midpoint, we call that a mid-sagittal plane, where you'll have equal amounts on the left and equal amounts on the right. Or you can make a parasagittal plane, which means that you cut off center. So you might give the left side a larger section than the right side. Either way, a sagittal plane means that you divide left and right. Frontal, also known as coronal, is when you're going to cut in a way that you divide the body in a front and a back, or an anterior and a posterior, or in the case of us standing up, ventral and dorsal. Remember, you can only interchange those with items that are standing upwards on two legs. The four-legged creature, like our cats and our dogs, are a different story. Either way, in a frontal or coronal plane, you cut so that the subject has a clear front and back. So sagittal was left and right, and frontal or coronal is going to be front and back. Then we have what we call a horizontal plane or a transverse plane, and this one is utilized to cut the body in the way that you have a clear top and a bottom. So imagine cutting through the belly in a horizontal way, allowing for the division of an upper body and a lower body. This would then be a transverse plane. And last but not least is an oblique section. And the oblique section is when you cut at an angle other than 90 degrees. I'm going to show you that on the picture. Hang in there with me. Let me show you here. So here is our subject standing in her standard anatomical position. As you can see, our first example, we have a mid-sagittal plane, and that means sagittal means that it's going to be cut in a way that you have a left and you have a right, and because it's mid-sagittal, that means that it's cut evenly in the midline. Here on our second example, we have a frontal or coronal plane. So once again, we see that the cut is made, but now instead of having left and right, we have anterior and posterior, or front and back. And then the transverse plane is when you cut down the midline so that you have a top and a bottom, a superior and an inferior. And I said to you before, you also have the oblique. So the oblique is when you cut other from the 90-degree angle. So that would be, for instance, if we cut at an angle such as this, that will then allow us a more angular or oblique section that we are looking at. So anytime you look at the cuts and you see that the planes are made at a degree that is smaller or larger than 9 degrees, you can just go ahead and say that that is an oblique section. And I do like the images below as well, because it allows you to see how you can study the human body in different imaging, all depending on the cut that was being made or how the body was divided to be put on display. So once again, mid-sagittal, or I should just say sagittal, will be a division of left and right. Frontal will be anterior and posterior. And then transverse will be superior and inferior, top and bottom. But also like to point out that as we start learning more about the body, we will also mention the different internal cavities that we have for our body. So things like our thoracic cavity, our abdominal cavity, our pelvic cavity. And when we do these things, you will often notice that they will be sectioned off based on what we call the dorsal body cavity and the ventral body cavity. And these terms should look familiar because we've mentioned them before. What we basically see happening is that dorsal will reference anything happening towards the back. But in this case, we're going to just go ahead and focus on items that are happening in the back of the head and the spine. And then the ventral will take a look at all body cavities that are towards the front of the body. And as always, it's better to show an image than have me describe it. Definitely not draw it. So here we go. We can see that we're looking at a lateral view, which is the side view of the body. And you can see that here in yellow, the dorsal body cavities are going to include the cranial cavity where we find our brain, You can see right here where the spine is coming down, and then the vertebral cavity, which is where the spinal cord is housed within the vertebra. And then the ventral body cavities are going to be towards the front. So you can see it has the thoracic cavity, it has the abdominal cavity, and it has the pelvic cavity. And when we do an anterior view, which is that we're looking at the front of the body, it really does highlight the fact that you have the thoracic, abdomen, and pelvic cavities all being classified as ventral. And you could start seeing the start of the cranial cavity, but please keep in mind that that is part of the dorsal body cavity because of its extension from the brain down to the spinal cord. All right, and that is it. So please keep in mind that was just a brief intro into some of the directional terminologies. As we get more familiar with the body, we're going to have the opportunity to practice utilizing them more and more. So for now, please take your time, take a look at the chart, think of some examples of how you would use your terms such as superior, inferior, anterior, posterior, medial, lateral, and keep in mind that practice makes perfect. So if you need any additional examples, feel free to go ahead and send me an email. And of course, if you have any questions, comments, or concerns, please feel free to reach out and let me know. Having said that, we're going to finish off this chapter, and I hope to see you soon for our next. Bye.